Ini telah dijalankan lebih kurang 2 minggu dari 26 Disember 2020 sehinggalah 9 Januari 2021 pada malam ni. And dalam sepanjang lebih kurang 2 minggu ini, 3 aktiviti yang dijalankan. The firstly is pertandingan poster, which is the pemenang-pemenang akan diumumkan pada akhir segmen ini. So don't go anywhere and stay tuned. Seterusnya adalah Week of Acknowledgement, di mana fakta-fakta, informasi semua disebarkan melalui IG SMF UiTM Sungai Buloh, dan akhir sekali talk pada malam ini. Okay. So jadi tanpa membuang masa, saya mengalu-alukan tetamu kita pada malam ini, doktor yang famous, yang saya selalu juga tengok dia masuk TV, doktor yang cantik, dan senang kata beauty with brain lah saya gelarkan doktor ni, iaitu Dr. Liyana Dhamirah Aminuddin, dermatologi specialist in dermatology, Fakulti Perubatan UiTM Sungai Buloh. Okay, apa khabar doktor? Sihat?
Sihat. Assalamualaikum, salam sejahtera. Thank you everybody for making time. Kita semua, saya haraplah kita semua termasuk diri saya sendiri, hari ini kita semua dapat belajar sesama sendiri dan dapat manfaat daripada session ni. Okay,
InsyaAllah. Okay. Saya rasa tak terlambat lagi kalau saya nak ucapkan selamat tahun baru doktor.
Happy New Year to everybody too, and yourself, Hanis.
Okay, thank you doctor. And I hope this 2021 will bring a good things to you. Yeah, a better year for you and also the viewers.
Yes.
Okay, so so content kita pada malam ni, firstly of course about skincare. Okay, kalau kita tengoklah kan doktor, ramai orang dekat luar sana tu yang habis beratus-ratus untuk beli skincare, untuk try macam-macam produk, brand, and ada juga yang beribu-ribu untuk buat facial treatment sahaja. Tapi kalau kita tengok dah habis banyak duit tu, tapi still muka dia orang tu tak macam apa yang mereka inginkan. Macam tu. Just sebabkan satu faktor je, iaitu diet. Diet pemakanan tak jaga. So boleh tak doktor kupaskan sikit tentang diet kita seharian ni adalah penting untuk mengekalkan kulit yang cantik dan bagus macam tu.
Okay, first kita berbalik kepada apa itu kulit yang cantik. Kan ada orang kulit yang cantik tu dia punya definisi berbeza-beza. Tapi secara amnya, in general, what is beautiful skin? So beautiful skin tu skin yang healthy, skin yang sihat, kan? Kulit yang sihat, kulit yang tidak tona warnanya sama, kulit yang tidak ada parut, ya, itu kulit yang sihat. Maksudnya dia tak ada apa-apa masalah atau penyakit di atas kulit tu, kan. Kulit ni memang, kulit is our largest organ. Maksudnya it's not just on your face. Memang on your face tu is important because orang nampak, that's the first thing orang pandang dan cakap, orang nampak muka you, kan. So taklah tengok mungkin tangan atau kaki you, tapi dia tengok muka you. So muka tu sebagai kita punya pasport, kan, ataupun kita punya image, kan, image yang sangat penting untuk kita portraykan kepada someone. So kalau daripada segi muka tu, orang tu walaupun dia tak mandi tapi muka dia macam berseri, orang ingat, oh dia ni mesti mandi, padahal kita tak mandi, betul tak? Okay, so daripada muka itself, it's very important. So that's why saya rasa ramai kat luar sana tertekan, kan, sanggup keluarkan duit beribu-ribu, kan, pergi farmasi lah, pergi beautician, pergi doctors dan sebagainya, sanggup sebab image, kan, sebab image, and it's important. So kulit is our largest organ, again I'm saying, so this is not just about beauty, but it's about our personality, keterampilan diri yang penting untuk orang dapat capture a good impression of yourself.
Yes.
So kenapa ramai di luar sana yang masih tak dapat lagi apa diorang inginkan? Mungkin diorang ada definisi yang berbeza. Mungkin kulit dia dah cantik tapi dia rasa kurang cantik lagi. So berbalik kepada saya, balik general balik, kita balik ke selagi kulit you tak ada masalah penyakit dan kulit you tak ada tona warna yang berbeza-beza dan kulit you tak ada scars dan tak ada parut-parut ke, that's actually already a healthy skin, kan? So macam mana kat luar sana yang walaupun dah bayar berbaku duit tapi still tak dapat? Satu, you kena tengok expectation you. Number two is it's not just what you pakai, kan? It's also, as you mentioned, diet, kan? It's also lifestyle, kan. Seorang tu walaupun kulit dia cantik tapi mungkin dia tak cukup tidur, kan. Umpamanya kulit dia jadi kering, nampak macam eye bags, nampak letih. So walaupun kulit dia sihat tapi dia nampak macam ceria dan dia nampak kulit tu tak nampak berseri, kan. Lifestyle dan pemakanan memang penting. So kalau you nak fokuskan kepada diet, macam mana diet tu boleh menolong? A lot of research di luar sana dah memang menunjukkan setengah makanan yang kita ambil boleh menyebabkan kita punya jerawat naik ataupun bukan untuk semua orang. It's not like one size fits all. Bukan semua orang yang makan sesuatu makanan tu dia terus naik jerawat ataupun jerawat dia jadi teruk. Tak. Tetapi ada sesetengah orang yang memang disebabkan diet tu boleh menerukkan lagi atau keadaan tu lebih teruk lah daripada asal ataupun daripada tak ada jadi ada. Yeah? So what are the diets yang orang selalu tekankan untuk kita jauhi ataupun kita kurangkan untuk memastikan kita tak dapat semua masalah jerawat lah kita fokus pada masalah jerawat. You guys are all young. Your first number one problem for skin is acne kan. So acne, apa yang boleh menyebabkan jerawat is of course sugary stuff. Okay, benda-benda yang high in sugar. So a lot of things to do with your sodas, with your sweets, candies, desserts, your cakes and your cupcakes and your muffin and your bobas, right? Okay, all those are the culprit to why if you take it excessively and you take it every day, will cause bad skin. And it can cause acne or maybe some sort of problems to your skin. Okay. Other than that is benda-benda dairy, benda yang terlalu banyak benda-benda ternisu. And a lot of people like cheese. Sekarang cheese ni kan macam trend kan. Everything ada cheese, goreng pisang cheese. Segalanya benda cheese lah kan. So cheese pun if you take in a lot of quantity terlalu banyak ataupun bukan cheese saja, susu kan, benda-benda ternisu akan boleh menyebabkan you ada acne as well. So research has shown, a lot of research dalam buat studies has shown that these are the two things yang boleh menyebabkan acne ataupun menerukkan lagi keadaan lah.
I see. Okay. Kalau makanan yang berminyak.
Okay. So benda-benda macam yang cakap pedas pakai cili naik acne. Not really, but kalau makan pedas tu jenis yang macam you makan pedas banyak and then you berpeluh banyak, maybe that would cause, because excessive sweating can also clog your pores juga. So those things are factors. So acne actually multifactorial. Kalau cakap pasal jerawat, memang banyak faktor yang boleh menyebabkan you ada jerawat. So kalau apa-apa yang you rasa you ambil dengan kadar yang terlalu banyak, usually will have a bad side effect kan. Doesn't matter if that side effect is good pun. Kalau you makan banyak sangat pun it will cause something juga kan. So makanan macam pedas, makanan macam berminyak, of course berminyak pun boleh lah. Berminyak tu lebih kepada kesihatan sebenarnya. So dia lebih kepada mesti dan sebagainya. So kulit belum ada lagi sangat research yang macam focusing on just oily food. Maybe junk food that has high glycemic index. Maksudnya dia punya makanan tu bukan kata kita sugary kan, tapi macam dia makanan macam for example roti yang boleh naikkan kita punya insulin level. Paras gula kita sangat tinggi bila kita makan kan. Itu boleh menyebabkan acne dan jerawat.
I see. Very clear doktor. Saya pun belajar benda yang baru. So saya rasa I think kalau dekat girls kat belah sana tu, kalau untuk contoh ada event ke, ada kenduri kan, kalau boleh 2 minggu sebelum ke sebulan sebelum tu jagalah makan.
Kalau you nak kahwin ke apa kan, so you ada macam big, yelah you nak pergi, you punya for example nak ambil school kan, dah nak graduate kan, you rasa 2 minggu lagi daripada sekarang, okay, just try and cut down on your sugar intake. In the long run, not just acne tau, for sugars, for example, kalau you take it excessively, like you take it every day, benda tu jadi macam benda yang you makan setiap hari dalam kuantiti yang banyak boleh menyebabkan proses penuaan tu berlaku dengan cepat.
I see.
It actually destroy your collagens and elastins. So that is why some people you see, aside from the sun actually also causes wrinkles and everything lah. Memang wrinkles, kedutan dan sebagainya disebabkan matahari, betul. Tetapi juga makanan dari segi makanan yang bergula boleh menyebabkan collagen dan elastin anda juga maksudnya dia punya pecah ataupun rosak lah dia punya all the bonds lah. So that's why you get aging process to happen faster if you take a lot of sugar.
I see. Okay,
that's
faham.
Alright.
Okay, faham. So maksudnya kalau nak ambil tu boleh tapi jangan berlebihan lah. Okay. So for next, kalau berkaitan dengan stres pula doktor. tak kisahlah kan, orang yang stres semua tak lari pada stres. Doktor pun saya rasa stres, teman-teman pun belajar. Kalau contoh minggu exam tu lagilah kan. So masalah yang common selalu dikaitkan dengan stres ni adalah breakout. Contoh kalau ada budak ni lalu kita tengok ada breakout, mesti kita tahu dia ni stres ya, macam tu. So apa pendapat doktor? Saya nak tanyalah, why do stress people prone to have breakout?
Okay,
Macam tu.
so when you are stressed, your body naturally will produce a hormone called cortisol. Kan? So hormone cortisol ni dia actually menyebabkan ataupun dia stimulate kelenjar-kelenjar minyak di muka ataupun di bahagian kulit lah. Selalunya dekat muka kita certain areas memang ada lebih banyak kelenjar minyak. So bila dia stimulate ataupun dia dia stimulate kelenjar minyak ni akan menghasilkan minyak. So bila minyak ni terlalu banyak daripada biasa, dia akan clog kita punya pori-pori ataupun dia akan menyumbatkan pori-pori, dan di situ berlakunya penghasilan di situ berlakunya tempat bakteria membiak. So jadilah acne. So bila kita tengah stres, memang kita dikawal atau kita tak dapat mengawal kita dengan stress hormones, itu yang menyebabkan kita ada acne. Most of the time.
Oh, faham. Tahu pula kalau waktu stres ni kita tambah perempuan lah, makan pula aiskrim, sugar intake lagi tinggi.
That's why I said back to acne tu banyak multifactorial. So it's not just one thing. So of course kalau one thing tu extra, dia lebih cepat lah dia akan menghasilkan jerawat-jerawat yang lebih daripada biasa kan.
Faham. Okay, faham, saya tahu. Okay, so kalau doktor tak keberatan, boleh tak doktor share the simple ways untuk pelajar-pelajar ni kalau waktu exam ni untuk dia elakkan breakout, the simple ways.
I think nak cakap jangan stress is totally memang tak boleh lah kan, obviously kan, memang out of the question lah kan. You need that kind of stress to excel. Somewhat your body needs it to actually push you further. Okay, so in terms of the environment, what you can do is you try your very best to actually make sure that you have enough sleep. Okay, I know like you'll be studying late nights and everything, so tapi maybe you try to take some time to actually allocate lah, okay, whatever it is I need my rest, because you have to know that your sleep is also very important. Your sleep actually generates the memory. So when you don't sleep, you takkan ingat apa you belajar. So bila you nak ingat dan nak pastikan memory apa yang you belajar tu stays in the memory compartment. So you have to make sure you sleep. So you have to have enough rest. That one you have to put aside sometimes. So you cannot just go like every night for 2-3 pagi for a long time. Because you will tire yourself at the end. When the time comes, when the exam comes, you dah macam totally worn out. So that's one thing juga kita tak nak kan. Okay, so sleep. Number 2 is drink plenty of water, because when you drink a lot of water, you also try to detoxify yourself, not just yourself in terms of your skin, you're also your whole system, immune system, then your whole body system, all the other organs. It needs a lot of water to detoxify. Okay? So number 3 is you have to make sure that you also practice good skincare. So to practice good skincare, you have to understand what kind of skin you have to begin with. So some people have that problem. So we'll talk about that lagi lah when I have a different separate question. Because when you know the right skincare, when you know your skin type, then you will know the right skincare for yourself. Sebab skincare ni actually once you hit it, like you know that the right one for you, you will definitely have good skin. Okay, of course kalau you ada masalah macam masalah jerawat atau masalah benda-benda lain yang atas kulit you, itu harus dirawat. Itu bukan saja menggunakan skincare, you have to rawat first, then you maintain good skincare. Bila dah baik kan, dah pulih, you maintain with a good skincare regimen, then you will maintain to have a good healthy skin. Okay, so so don't forget to practice good skincare and make sure that you know your skin type at the very beginning. And if you do need help, just seek help first before you just keep trying, and at the end you just worsen the whole problem of the skin. And then anything else, if you could actually make time to exercise, would be really good, because that also makes sure that your pores semua terbuka while you exercise, kan, so tak sumbat dan sebagainya. At the same time you also sweat. And you detoxify your body. So those things are, and you also balance up your hormones when you exercise, because the happy hormones will also increase and stuff like that. So to reduce your cortisol level. So those things will definitely help. So those are really basic stuff if you can make time.
Okay, I see. Okay, thank you, Ruth. I think the four things that you have mentioned before, I think is very crucial for me and also the viewers. Okay, so next, okay, setakat yang saya tahu lah kan, the basic skincare steps ni ada 5 tau. Cleanser, toner, serum, moisturizer and also sunscreen ataupun SPF kan. Tapi dulu saya macam saya tak amalkan pun sunscreen tau. Sekarang baru saya tahu betapa pentingnya sunscreen tu. So saya percaya ada juga viewers yang hanya amalkan 4 sahaja. Sunscreen dia orang tak pakai. So boleh doktor sharekan sikit tentang kepentingan sunscreen dan macam mana untuk pilih the best sunscreen untuk kulit kita. Sebab ada yang dia punya plus tu ada 4 kali, ada 3 kali, ada yang SPF dia 30, 35 macam tu, 50 pun ada macam tu. So boleh doktor ceritakan sikit.
Okay, so back to your skin regimen. Yes, I agree with your cleanser, toner, moisturizer, serum. You got serum, moisturizer / serum. Moisturizer dengan serum tu lain. Moisturizer and serum tu boleh sama ataupun moisturizer lain, serum lain.
Lain.
Lain
Lain kot. Lain.
Apa? Last kali sunscreen at night lah kan. Sunscreen during the day. Okay, so toner, okay, so cleanser is important to choose the right cleanser first. I just go through your skin regimen.
Okay.
To make sure that everybody faham. Yang ada mungkin you pandai, mungkin ada yang tak sure apa lagi kan. Mungkin you dah macam buat your research, you dah tahu kan everything. Maybe out there they need some help to just clarify the skin regimen. So the cleanser is very important. So what kind of cleanser do you choose? Okay, so I would normally suggest take very, very gentle cleanser. So when you choose cleansers, make sure that you don't choose cleanser yang bagi muka you rasa macam bersih sangat. Sampai keluar-keluar je ketat, like really, really clean. So I used to think when I was young, I used to think that's the best way of, cleansing your face. Because, when you dah habis basuh sabun tu, yang muka rasa macam ketat dan rasa, ni bersih betul sebab tak ada minyak langsung lah atas muka. So that is wrong because you want your natural oil in your skin. So what happens if you totally wipe off all your skin, punya oil, that means you tak ada langsung, you dah cleanse everything semua, tak ada minyak langsung dalam muka you, kat atas muka you, dia akan menyebabkan rebound. So like your skin macam, oh no, there is not enough oil or there's not enough natural moisturizer on your skin, I need to make more. So that's when you do eventually get oily skin and you get acne prone skin because of that. Because your kelenjar tu macam like, oh no, I think I have to produce more. To produce this lebih, it's like the overproduce because of the cleanser. So choosing the right cleanser is very, very important. There's plenty out there, so if you need to kind of choose what suits you, it's fine because you need to get the right one. Just make sure that you get the right one. So for me, some people are, if you've got eczema ke, atau ada psoriasis ke, atau memang kulit kering in general, so maybe you have to lay off cleanser yang fancy sikit, yang macam too much fragrance or too much soap, like you have to like lay off that. But those people that tak ada issues with their skin, then they can practically choose any cleansers, even yang the fragrance ke apa. To me, I'm not too strict about that lah. Okay? But of course, if you want to be safe, then of course go with the ones yang no foam, no fragrance, that kind of thing. Okay, so that's cleanser. And then toner, yes, you need not to say. And you have to get what kind of toner it is. So toner dekat luar tu banyak. So ada yang mainly for acne, for example salicylic toner or glycolic acid toner. So those are for acne prone skin where they control your oil in your skin. Okay, so there's some also toner yang macam hyaluronic acid, which is actually to moisturize your skin. So toner plus minus. So some people may need it and you might not need it. If you have already a good, beautiful skin, you just continue with the next step, which is moisturizer. It's good enough. So toner is not for everybody or not all the time. Tak adalah kata wajib lah, I would say. So moisturizer and serum is to me at your age for young skin. You can choose just one. Either you use a moisturizer or serum, depends on your skin type. So even a moisturizer has to depend on your skin type. Kalau your skin is jenis yang macam very, very dry, then you need to get a cream that's a bit thicker, or a bit creamier. But your skin is normal or combination, just get something light. It will do like a very light cream or even a serum will do. Because myself, I just use serum most of the time. So even gel pun I just use gel. So I suka benda yang cepat meresap because I don't really have a problem with dry skin. So I don't go with really thick thin ones. For those yang memang oily skin, so you have to go with a lot of water based, just like something that you put on your face and immediately be absorbed. So you don't try things like very, very creamy or heavy because that could cause acne. Okay, so those are very, very simple ABCs to choosing the right moisturizer. Okay, and then for maybe a bit elderly, or not elderly, a bit matured skin like myself, then we probably need more help in anti-aging serum, probably need stuff like vitamin C serum for wrinkles and under eye perhaps, to just hydrate a little bit more, things like that. So we probably need a few more steps as compared to young skin like you guys. And of course, lastly, would be your sunscreen. So how do you choose sunscreen? So sunscreen, there are a lot out there. Okay, memang some of it is already incorporated into your makeup, for example, into your foundation, into your concealer, into your skin powder and your powder pack and everything. So is it enough? Is it enough or not? Well, you have to look at the SPF and the blockage. So I think, which means how much SPF plays a role. So it doesn't matter. As long as it's above 50, it's a very good coverage. It covers more than 99% of the sun UV rays. So UVA and UVB, it has to be both. So because we have UVA rays and UVB rays, that damages your skin. So you need to make sure that you protect to both UVA and B. So you have to have SPF that's above 50, UVA and B. So some out there, some market as SPF 90 and all that. So as long as it's above 50, it's fine. But if it's SPF 35 or 30 or 20, sometimes you see in your cosmetics, it's not enough. So if you do need, of course, young skin, you're not very aggressively thinking about protecting your skin, right? So if that's your choice, let's say you say, I think it's enough that I just put on my concealer or my foundation, cukup lah 25, 35 or something. Then tak apa, it's okay. I mean, at least there is some coverage. But if you're talking about something that you need to protect betul-betul, what is the right or correct way of protecting yourself from UVA and B? It has to be SPF 50 and UVA and UVB block. Okay?
I see.
So if you have cosmetics that has that, that's good enough, or else you have to pick it up with something else that's meant for sunscreen on its own.
Okay.
So choosing the right sunscreen is important as well, because some sunscreen can be a bit heavy. So if you put it on your skin, you might break out. So you have to make sure that it's a sunscreen that's very light, that doesn't cause greasiness on your skin if you have any skin. So for myself, I like something that's gel for my sunscreen, because I immediately absorb into my skin. So I don't feel like there's another layer at the end, because I already the things I pakai is like easily absorbed anyway, because I don't need something too heavy because I don't have dry skin kan. So I like it when I just put it on, like a couple of minutes, it feels like I don't have anything on. Okay. So same thing with you guys. I mean, you guys have some sort of preference just like mine. As long as you put something on, don't worry, it's still there. So much you don't have anything on your face because it's all absorbed in. But yeah, so it's still there, it's still protecting you. How do you use the sunscreen? Do you know?
Not sure.
A lot of really good posters out there. As I was reviewing all the posters, like I was really happy to see a lot of you actually know your stuff, and it's very hard to say, very warming to see, because of course like skin is my thing, and so I see people like knowing a lot of stuff. It's like, oh, it's so nice to know like that everybody knows things about skin, and especially you can. So okay, so how do you use it? It's actually the best way is actually every 4 hours. Depending if you sweat a lot, then you probably have to reapply your sunscreen. Otherwise, the best way is 4 hourly. But myself, when I don't reach 4 hourly, I just probably use it once or maybe twice needed. But most of the time it's just once. Even indoors, because the sun actually penetrates through the windows and doors and everything as well.
So outdoor ke indoor ke kena pakai juga
Yeah.
I see. Okay. So kalau lah let's say doktor 5 basic steps tu dia dah jadikan rutin lah. So nak upgrade sikit. Nak tambah exfoliators. Macam tu dalam rutin mingguan. So jadi apa kebaikan exfoliators, and macam soalan yang tadi juga, jenis exfoliators yang sesuai digunakan secara generalnya.
Okay, so exclude lah. Exfoliators actually is very important. I was just going to get to that. Kenapa exfoliating penting? Sebab kita ada lapisan kulit yang mati di atas, paling atas. So ada hari yang kita tak sihat atau kita kurang we're just not healthy lah basically. So our skin cycle takes 4 to 6 weeks. Dia nak dapatkan skin baru. Kenapa baby selalu cantik sangat kulit baby ni? Sebab dia skin cycle sangat pendek. So every like 2-3 weeks dia akan like baru punya skin. That's why baby has really, really nice skin. But as you grow older, your skin cycle gets longer and longer. Or when you're sick or you're not well, the skin cycle gets longer and longer. That's why you tengok orang yang tak sihat, kulit dia kusam, kulit dia macam tak berseri dan tak glow, nampak macam tak sihat. It's because your skin cycle to gets longer and longer. So there are things out there that you can use on your skin that can actually regenerate ataupun make your cycle faster. To exfoliate and make your skin faster. When you exfoliate means you remove the dead cells, then new skins will come out to replace that dead cells in layer. Okay? So what are the best exfoliators out there? Of course, there are the simple stuff like scrubs, right? Scrubs out there when they have all these gels and all those and stuff. So those are also physical, meaning like when you put it on, you dah boleh rasa that actually physically like it's kind of like sandpapering your skin. So how often do you need to use it? Like for me, I would just suggest 2 to 3 times max in a week. Kalau macam your skin dah memang cantik, that you already have that glowy, healthy skin, you probably can cut down your exfoliation. You don't need 2 to 3 times a week. Maybe just need once a week or maybe 2 weeks once for myself. So there are scrubs out there you can use. There are also solutions like even glycolic acid solution. Those things are yang you call it alpha hydroxy acids. Yang you have to know those are the umbrella is alpha hydroxy acid, and bawah tu ada glycolic acid, lactic acid, and a few other acids that you can use as exfoliators for your skin. Okay, there are also things yang macam doctors give macam retinoic acid that's also very good for your exfoliation or renewing of skin, new skin, which I myself use because I have access to it, right? Because the retinoic acid is a bit tough because sometimes doctors need to prescribe it because when you use it wrongly, then you get really dry sensitive skin and things like that. So that's why it's not over the counter easily, especially in our country. But overseas, sometimes you do get to see it over the counter and you can buy easily, but not in Malaysia. Maybe because dia tak percaya lagi kot orang payah nak guna kan. Okay. So that's why retinoic acid doctors are the ones that prescribe it. So when you use retinoic acid, we use it just at night. And you can see a lot of difference in terms of the skin because it also prevents aging and all sorts of things. So that's one of my favorite recipes juga lah in terms of exfoliation. Yeah. Okay. For you guys out there, if you want to just use scrubs, it's fine, as I mentioned macam mana. And then things that you have, there are gentle exfoliators that I mentioned, like acid, and so on. Those things can also help for yourself. So again, just go with your skin. If your skin don't need it, don't exfoliate too much because it can also cause sensitiveness.
Okay, I see. Okay, so kita dah bercakap tentang skincare tadi kan. So kita dah kupas banyak pasal skincare. Tapi let's say kalau ada penonton-penonton YouTube ni ada hasrat nak berjumpa dengan dermatologist, and then sebab nak jadi cantik macam doktor kan, nak ada kulit macam doktor kan. So tapi dia orang tak tahu macam mana keadaan ni memerlukan dia pergi berjumpa dengan doktor. Macam what kind of condition yang require us to go to the clinic. And kalau contoh macam sebagai contoh saya bagi, kalau contoh ada jerawat and also mole, tahi lalat kan, should they worried about that?
Okay, so skin in terms of acne, kalau macam usually korang punya age group memang it's acne problem. So acne, what is normal? Normal to have acne, right? At your age, especially women, the girls, and you guys, young girls, always get acne just before your period, just after your period. Okay, so normal acne, 3-4 lesion atau 3-4 on your face, it's okay. Yes, but if you have persistent acne, meaning it's no longer cyclical, it's always there. Sentiasa ada jerawat kat muka yang tak pernah baik. Tumbuh satu bawa nak baik, tumbuh lagi 2. Satu 2 ni nak bawa baik, tumbuh lagi 4. That kind of thing. So you have persistent acne and it seems it's just not going away, then please seek help. So how do I seek help? Okay, so you can go to klinik kesihatan biasa and like see if they can help you out. But usually in klinik kesihatan, they will give you things like antibiotics and stuff like that. So they don't really, because of course different doctors different way of treating kan. So skin regimen ni, it's more to people feel like doctors feel that they are not, is that not their expert. So they're not the expert in talking about skincare. Maybe they themselves pun tak ada the perfect skin regimen for themselves. They can be, because it's not something that they like. Not everybody is into skincare. So, but if you need help, those antibiotics do help. Kalau kat klinik kesihatan. But if you say that, it's not working, you might need to be referred to a dermatologist, then you just go to klinik kesihatan and say, okay, this is my problem. Can I get a referral letter to a dermatologist? So then you can be referred to a dermatologist that's nearest to your area. So this is talking about government setting. Kalau macam you want anything that's treated under the government setting. So government setting, then you'll be seen by a dermatologist. You'll be given things like acid, benda-benda yang I mentioned just now. Okay, there are other things that you can give as well. So, but for myself, if it's my preference, I usually, of course, again, different doctors have different ways of treating, and I'm not saying that other ways are not correct. Semua it's just like, macam kita nak masak kari, you cari lain, cara lain, tapi produk dia sama. Macam tu kan? Lebih kurang macam tu lah.
Okay.
So at the end of the day, we all want to reach the same goal. We want to give you a clear skin, right? So, but different ways, different doctors, different approach. So for myself, I suka treat with skincare first. Like I try very much to go into your skincare details, like what you use, how to use, correct things to use, because I tak suka makan ubat forever, right? Especially like for just acne. Okay? Unless it's acne yang besar-besar, ketul-ketul besar-besar, yang memang really deep, that really bad non-cystic acne, then you really need to put yourself on medication, because that is the fastest way to make sure that you don't have scars on your skin permanently. So you need to get that treated and all sorts. So it takes a while, about 4 to 6 weeks, then you can see some difference. Sometimes dia akan jadi teruk dulu. So I've got like patients yang datang and they're like, no doctor, I must ubat you lagi teruk, like really, really bad, sampai nangis. But I press really bad because like, yes, that happens, but that's only temporary. So kan memang kena sabar lah, basically at that point of time. So those things can happen. So that's how you can be referred to a dermatologist. But if you have extra or you have financially, you are not tight, you have means to go, there are always aesthetic doctors out there that can help you out with a lot more options. So when you have options out there, it doesn't have to be taking orally. So if I would have a chance to treat you outside of the government setting, there's a lot of other things that we can do. We can do chemical peeling, we can use other things on your face as well. So I can focus on your skin regimen. You can buy some product that's not available in the government that can help you with your skin. So of course, lagi banyak you ada financially finances to support, lagi banyaklah option you. Tapi kalau you tak ada option, best is get yourself referred to dermatologist and we will sort your problem out.
I see. Okay, faham. Berdasarkan doktor cakap about financial kan, let's say kalau dia nak pergi ke swasta juga, macam tu, macam I think the cost and or the price of the treatment should be one of the big issue juga sebelum pergi ke klinik kan. So kalau let's say dia nak pergi juga ke swasta, boleh doktor share sikit tentang cost yang viewers boleh expect?
Okay, so a cost that you expect each time that you visit, it can be from as little as RM100 to RM400 per session, depending on what you do. Of course, kat luar sana ada banyak packages juga kan. So there's when you sign up for a package, for example, chemical peeling, maybe per session it's about 100 something, at most 200. Because like chemical peeling are not very expensive. Those are like the paling yang most affordable. There are things lasers and everything. Semua tu it's on the higher side. So for acne, it's quite a simple management. Like chemical peeling can help. Or microdermabrasion is like a suction to remove your dead cells and like to actually reduce your scarring, and also you can actually infuse solution to your skin. So those things are also not very expensive. So that's about 100 to 200 per session. So how many times do you need to do it, right? So usually if it's not a bad case, I would say initially you probably need 4 sessions to clear, 4 to 5 sessions to clear, and then you just probably maintain it once a month ataupun 2 months once your skin dah normalize, it's back to its optimum environment and optimum health, then dia akan takkan ada terlalu banyak snag issues with acne breakouts, and you pun dah pandai use the right products, so you can actually control your acne from activating that you used to.
I see. Okay, I see. Okay, so sebelum tu untuk penonton-penonton YouTube, sesiapa saja yang ada soalan untuk Dr. Liyana, bukan senang kan nak jumpa Dr. Liyana secara live kan. So kalau sesiapa saja yang ada, kami akan memilih soalan tersebut, and then berpulau untuk juga menerima cenderahati eksklusif daripada tim Selangor sendiri. Okay, so doktor, saya sendiri ada soalan doktor. Doktor ada any tips untuk reduce, macam mana doktor cakap tadi, untuk hilangkan acne scars if laser treatment not available ataupun doesn't work, macam tu.
Okay, so usually kalau it depends on what kind of scars kan. Acne ada banyak scars. So ada scars yang memang just colour, maksudnya is hyperpigmentation, which is brownish spots sebab bekas jerawat, ataupun acne scar yang dalam that has macam scar yang it's deep lah, we call it box scar, ataupun benda yang macam menyebabkan skin tu ada macam bukan berkedut, what you call that? Ada macam lubang-lubang, berlubang, berkawah dan berlubang. Okay, so kalau yang tu is a different type of scar, so lagi susah nak treat. So apa yang on the surface is easier to treat, apa yang dah deeper of course it takes a lot more. That's why we don't want you to have that berkawah dan berlubang-lubang tu, because itu yang sangat-sangat susah nak treat. Because nak dapat balik punya complexion yang licin, dan tu memang agak sukar bila dah ada. So bila kita cakap pasal benda-benda yang superficial ataupun benda-benda yang just the dark spots, that one actually eventually, if you are very young, eventually it will go off. Okay, it should go off lah. If you use the skin regimen, you exfoliate, okay, maybe 6 months to 1 year, it would not be there anymore. But if you're talking about benda yang berkawah dan berlubang, then you need more help. You need things like macam lasers or dermal rollers, things yang memang actually you have to give some sort of physical punya injury to your skin, that you need your skin to renew it back, macam renew your collagen dan sebagainya, dan cell dan sebagainya, to make sure that you get back that skin yang rata. Okay, so a lot more work when you have that kind of scar. So apa yang you boleh buat untuk yang dark spots tu, you don't have to worry so much. As I mentioned, skincare regimen boleh. Lanthanuric acid that I use, that doctors can prescribe at night can help also to reduce the scar faster. Vitamin C serum can help with that kind of scar. But benda yang berlubang dan berkawah memang we need a lot more treatment. It needs intervention. So best is to prevent it before it happens. So lagi lama jerawat lagi atas muka, lagi teruklah you punya scar. So kalau ada jerawat tu, silalah pastikan dia dah tak lama, dalam macam 2-3 hari dah baik. Kalau dah berminggu-minggu, maksudnya dia dah sampai dalam, dia dah masuk deeper layers of skin. When it involves a deeper layer of your skin, then you will have permanent scarring.
Okay, so for untuk viewers, untuk penonton-penonton YouTube Team Selangor, kalau kami akan memilih 5 soalan sahaja, dan kalau anda curious tentang hadiah cenderahati yang akan diterima dalam berbentuk t-shirt dan juga keychain daripada tim Selangor. Okay, so siapa ada soalan tu bolehlah komen dalam ruang komen dekat YouTube live sekarang. And then okay, so doktor, kalau berkaitan dengan soalan, okay, ada kawan saya ni, dia ada mole tai lalat, so dia selalu insecure sangat pasal mole ni. So should she worried about the mole, ataupun should she embarrassed ataupun malu tentang mole tu? Boleh ke? Macam mana tu doktor?
Okay, so malu tu memang saya tak tahu macam mana keadaan mole tu lah kan. Maybe dia rasa malu sebabkan mole tu macam mungkin dia mengganggu ataupun dia terlalu besar ke, ataupun mengganggu image dia kan. Mungkin dia rasa tak sesuai, ada mole ke depan tu ke, tak suka kan. So itu susah sikit sebab dia very individual. Tapi kalau nak cakap sama ada boleh bahaya atau tidak dari segi kesihatan, kalau selalunya mole ataupun kita panggil dalam bahasa tai lalat biasa, dia tak payah risau lah, sebab dia memang tidak mendatangkan apa-apa yang merisaukan ataupun apa-apa yang membahayakan diri. Tetapi ada penyakit yang banyak di luar sana yang takut, tapi dia lebih kepada not really Asian skin. Memang orang Asia ada penyakit melanoma ni ataupun dia nampak macam penyakit lalat, tapi sebenarnya dia kanser kulit, sejenis kanser kulit. Tak begitu peratusnya dalam orang-orang Asia sangat-sangat rendah as compared to mereka di luar, di barat lah, Eropah dan Amerika dan sebagainya. Kenapa? Sebab because they are exposed to the sun, they like to their type of skin diorang lain satu. Nombor dua is diorang suka berjemur di bawah matahari kan. Memang itu sunbathing is what they like. So then they are prone. Also it's also hereditary sebab dia macam lebih ramai orang diorang punya keluarga yang ada masalah tu dalam that line of inheritance, so their tendency to get melanoma is higher. So for us it's actually the risk is actually lower as compared to them. So bila kita rasa kalau kita takut benda tu somewhat cancerous, what you can see is if you tengok you punya tu selalunya dia punya size dia tak kecil, dia besar. So dia lebih daripada macam 6 is half, actually it's quarter an inch. So it's lebih kurang 0.6 cm something like that, so 6 mm lah. So it's actually not small. So it's actually quite obvious because it's not like titik kecil yang selalu tak lalat nampak. So that one you don't have to worry. So kalau size dia lebih daripada 6 mm for example, then you probably need to monitor. You rasa okay, maybe this one you can surgery. Kalau dia satu warna je, okay, so there's A, B, C, D to it. So A is like dia punya bentuk dia tak bulat macam cantik bulat selalu dia macam ada gerigi ataupun dia punya it's not symmetrical. So dia tak cantik lah dia punya edge. Okay, so that's A, asymmetry. Number B is border. Dia punya tepi-tepi tu tak macam normal lah, macam tak senang untuk dilukis. Dia macam ada jenis dia punya bentuk-bentuk lain-lain, irregular lah orang panggil. And then C is the colour. So colour dia tu lebih daripada satu warna. Maksudnya dia tak sekata, dia tak satu warna je, satu tona. Dia macam ada light brown, ada dark brown, ada hitam. Okay, so those are not normal moles. Those could be something suspicious. And D of course is the diameter, which is the size I mentioned. So you memang size dia bukan kecil, dia selalunya besar. So those things are something you can look up for. So if you're really not sure what it is and it has those criteria yang I mentioned, then you should seek for a second opinion or seek for a dermatologist's opinion to whether or not you should worry about it or not. Because in skin, dalam masalah kulit ni, sometimes benda yang dia nampak serupa tapi dia mungkin dua benda yang berbeza ataupun 10 benda yang berbeza. It could be anything, like you can have a red skin rash but it could be 10 different differential diagnosis. So you pun tak tahu apa salah benda rash sama, nampak macular ataupun bintik-bintik merah, tapi apa dia boleh jadi eczema, dia boleh jadi jangkitan kulit, jangkitan what a lot of things can actually present with the same thing. So sometimes you're just not sure, you can just seek for help and ask whether you need to worry about it or not. Kalau untuk kawan you yang rasa mole dan tak suka mole tu, you can always get it removed. Kalau you betul-betul ingin get it removed, you can get it removed. Usually a plastic surgeon will do a better job. Like then you can consult a plastic surgeon and get it removed.
Oh, it can be removed. I see. Okay, so doktor, sekarang kita buka question kepada dari penonton-penonton di YouTube Team Selangor. Okay, sekejap Okay, soalannya. Sekejap Okay doktor, saya tertanya-tanya, adakah dermatologis ni diorang doktor-doktor just fokus bahagian muka sahaja? Itu saya tertanya. Saya sendiri.
Okay, so dermatologist is actually pakar. Before you become a pakar kulit, you kena jadi pakar perubatan dulu. You boleh senang nak jadi pakar kulit. Sebab kalau you nak jadi doktor, kalau you daripada mula you graduate sampai lah you nak jadi seorang pakar kulit, it takes the very minimum now 12 years, the very minimum. So on average is about 14 to 15 years. Itu macam secara normal lah, about 14 to 15 years, then you can just become a full-fledged dermatologist. So it's not easy because you have a lot more stuff to before you reach there. So you have to make sure that you're a pakar perubatan surgeon. So when you're a pakar perubatan, that's when you actually learn a lot ataupun daripada belajar untuk jadi pakar perubatan, you tengok every single disease that a human being has. So you need to know kesemuanya. So untuk jadi pakar dalam pakar kulit, bukan muka saja yang kita tengok. So it's not kita muka tu sebahagian yang sangat-sangat kecil lah. Acne tu macam benda sangat kecil lah. Tapi I tunjuk you buku mana buku I. I dah ni jap. Okay, tunjuk betapa bersusahnya belajar ni jap. It's actually more than what you need to study for your medical experience. This is how thick
Wow.
the dermatology book that's a reference. And this is volume 1. And you have volume 1 and 2, okay? And that's just skin. Okay, so you practically have to know whatever that, kalau you tak tahu in detail, we kenalah somewhat tahu. Because as I said, one thing can present with a similar thing, but you have to stand differential diagnosis. So you have lots of stuff. So okay. So we focus on the disease itself. So sometimes what shows on the skin is actually connected to what's wrong with your body. So it's just a sign of a systemic illness. So you need to know, as a pakar Perubatan, you can actually then connect the dots. So that is why I like being a dermatologist, because it gives you a clue. So you jadi macam detektif. Apakah sebenarnya penyakit dia macam tu lah. So sometimes it's simple lah, you can letak macam something on the face. Tapi sebenarnya benda tu lain, could be dia allergic kepada shampoo dia ke apa ke, ataupun dia punya makeup ke, ataupun dia memang ada eczema ke. So it takes a lot of time to come to a diagnosis sometimes. Most of the time simple cases lah. Out there kat luar macam biasa lah. Macam in general, everybody will have the simple eczema, psoriasis. Those are the common skin diseases. But when you get the uncommon ones, that one becomes a challenge. So that is what I like about skin disease, because it's a challenge, because you don't know what it is. It can just be anything in the sign.
Okay, so doktor, ada soalan pertama dari viewers daripada Dan Arm. Okay, doktor, ada banyak orang yang guna natural things kat skin diorang, macam honey for example. So benda macam tu better or products yang memang untuk skin?
I rasa I have not against anything natural, because if you know what you're doing and you use natural things, of course it helps, because those things are God's creation. So there are a reason why they are created. So if you know and you know how to use it and you're very sure of what its content and it's really natural, I don't see why it won't help. Because honey, we know it's antibacterial, antifungal, and it has good properties, even to take it as a health supplement, kan? So if you know how to use it, yeah, go ahead. But for myself, whether or not I use honey on my face, I thought, because maybe I'm a bit more scientific kind of person, because I am a doctor that I know what ingredients and stuff that I need. So I'm a believer in that. So I feel that this stuff works anyway for me. So I tak dah macam pergi try sendiri kat dapur and like bantu and stuff. So, but if you guys know and it's that passion, you like to do it and you learn about it, as long as you research and know in detail what you're doing, I don't see why you cannot do it.
Okay. So another question daripada Danish Aziz. Assalamualaikum Dr. Liyana. Saya nak bertanya berkaitan post-inflammatory hyperpigmentation or acne scar. Oh, ini rasanya dah ni. Saya dah tanya dah tadi. Okay, kita move forward. Okay, Nurul, daripada Nurul Khairun Nisa Zaidi. Doktor, saya pernah dengar orang kata steam from hot water open up pores. So it's good to wash your face using it. Betul ke? Sebab ada pihak lain pula yang kata tak elok sebab nanti kulit kering. Mana satu yang betul, doktor?
I wouldn't do it as a regimen untuk hari-hari ataupun minggu-minggu lah. Sometimes you wanna feel fresh ke apa benda, you want to use it. It helps in terms of it can help. Because apa yang benda yang panas, usually what happens is you dilate your blood vessels under your skin. So even your blood vessels actually gets dilated, and then you will get more blood supply to your skin. Okay, that is one thing that it's good about using something yang hot. Kan? So that's why when you keluar, your face gets this pinkish look, kan? It's actually because of the dilatation of the blood vessels that's underneath the skin. Tapi nak kata it dries your skin, yes, hot water actually dries your skin. So I always tell those people out there that when you want to wash, you need to shower, try to just use lukewarm. Don't ever use really hot water, especially if you have eczema, psoriasis. You don't need to you think you're dirty, so you kind of take shower like maybe 4-5 kali sehari thinking it's good. Actually, it's not. So you don't need to take too many times to shower, because if you shower too often, you actually remove all the good oils or your own natural moisturizer in your skin. So you don't. I don't want that. So I usually advise, kalau if you want to use water, try to use the temperature that is just room temperature or slightly a bit warmer, lukewarm we call it. Don't use, jangan guna yang terlalu panas. Because yang terlalu panas tu memang boleh mengeringkan kulit.
I see. Okay, saya rasa jelas itu.
Mm.
Okay, next daripada Hanif Taqiyuddin. Doktor, betul ke kalau kita consume vitamin C dapat bantu dalam memutihkan kulit? And berapa dosage yang perlu kita ambil daily?
Actually when you cakap pasal vitamin C, lebih kepada kita konsum untuk kesihatan. Whether or not dia macam memutihkan kulit, actually it requires a very very high dose. Dan kita tahu kenapa, macam mana dia memutihkan kulit is actually dia boleh in a pathway yang memberikan kita punya warna kulit tu, dia ada some interruption dekat situ. Okay, so vitamin C ada lah juga can cause whitening, but it has to be in a very high dose. So kalau kita consume dalam tablet, we also have to know, to keep in mind that vitamin C yang kita makan tu, kita ada maksimum untuk body kita absorb, sebab dia adalah vitamin yang larut dalam air. So kalau you makan terlebih ataupun yang dosis terlalu tinggi, dia akan keluar as air kencing saja, sebab you detoxify ataupun dikeluarkan daripada body, because your body can absorb a certain amount already. Dia dah macam maksimum kan. So if you ask about putih, I don't think so at the normal dose, no. But of course there are out there people who are using a different kind of or a different way of vitamin C. So in that sense, it's a totally different thing lah. Because dia tak masuk dan makan kan, dia lebih kepada mungkin suntikan dan sebagainya. So yang tu kita tak boleh cerita lah kat sini. So yang tu macam kalau you setakat nak makan saja, memang tak boleh putih lah. Itu je lah jawabnya. You makan je lah yang untuk sihatkan badan tu. Yang penting, it gives your body enough vitamins, that it will also give your skin enough vitamins, so that will actually portray as healthy skin. Maybe not putih, tapi your skin will be healthy. Because you need that vitamins.
Okay, for next question daripada Muhammad Razil Abdul Rashid. Doktor nak tanya, contoh kalau kita nak ambil wuduk, tendensi untuk moisturizer and sunscreen washed away. So apa yang kita perlu apply after ambil wuduk?
You already apply balik yang moisturizer and sunscreen.
And then dia tanya lagi, doktor boleh tak doktor bagi tahu type of sunscreen and sunscreen yang sesuai untuk student that easy to apply, yang tak jadi putih after apply tu?
There are a lot kat luar sana yang memang dia tak putih. It's actually some of them memang ada skin colour juga. So you have to, as long as yang penting sekali tu is the one yang cepat absorb dan dia tak clog your pores. So kalau dari segi brand tu, it's a bit difficult for me to mention because it's apa tu, I tak boleh lah mention brand apa sebab but there are brands out there that actually follows your skin color and actually has SPF 50 and UVA and UVBs out there. UVAs and UVBs block yang memang gel like.
Okay, faham. Okay, so dari satu soalan lagi daripada Narfa Sulaiman. Does facial spa, for example extraction, vitamin C injection, anything else, really necessary as part of our skincare regimen?
No.
No.
Skincare regimen is as good as just skincare, putting something on your skin. That's when you have normal healthy skin. Right? Kalau you nak cakap pasal skin disease, maksudnya jerawat ke pigmentation ke, that is of course you need more than that. So that's why you need to see a doctor to get it sorted. What you need to treat your skin. So treating your skin and maintaining a beautiful skin or not maintaining a healthy skin is two different things.
Okay, so kita dah pilih 5 soalan. So kepada viewers yang tanya tadi, dah 5 orang tadi tu yang soalan yang bertuah dipilih, nanti tolong DM IG UiTM Medik, SMF UiTM Medik.
Banyak lelaki ya,
Itulah saya terkejut. Ya. Dia orang nak tahu tentang kulit dia orang juga. Okay, so nanti boleh DM SMF UiTM Medics untuk kami dapatkan details. Okay, so kita ada lagi sikit masa. Okay, kita nak kita ada buat juga question daripada IG untuk viewers daripada IG juga. So kejap
Oh ni ada masuk IG live juga.
Tak, dia just question kami sebarkan je, just menarik story. Kejap okay. So, doktor, so tadi kan kita dah bercakap pasal diet kan? Tapi doktor dah cakap tadi pasal sugar diet, right? Kita satu lagi soalan, what product ingredient wise should everyone have in their skincare routine? Yang senang nak dapat dalam Watson ke, Guardian ke?
Depends kalau what type of skin you have, what type of skin. Okay, I say hyaluronic acid is a good moisturizer to have. So everybody needs a good moisturizer, right? So as long as there's hyaluronic acid inside, you're pretty safe. Of course, there's a lot more fancy stuff out there. If you have, especially if you have the money, there's a lot more things that you can experiment. There's a lot of things that you can use on your skin that can be beneficial, kan? Tapi basic like hyaluronic acid serum, moisturizer, or cream is good enough as a good moisturizer.
Okay, hyaluronic acid. Okay, noted.
Dia nama je hyaluronic acid tapi dia taklah berasid dan mengakis. Tak, it's just a hyaluronic acid. It's just it's a type of moisturizer. You already naturally have hyaluronic acid under your skin. Everybody has hyaluronic acid under their skin. It's the moisture to your skin. But as you go older, you will lose like a teaspoon of it past 30 years. It has made sikit. So lama-kelamaan, that's why as you grow older, your skin gets droopier, your skin gets drier because you're losing your natural hyaluronic acid. So that's why you actually put yourself on good moisturizers.
Okay. Okay, so doktor, ni berkaitan dengan, saya pernah terdengar kalau perempuan dengan lelaki ni, orang kata lelaki ni tak macho lah kan kalau banyak-banyak sangat produk lokal tu kan, banyak jenis-jenis nama brand lah apa kan. Selalunya orang kata skincare ni mesti perempuan je. Skincare je perempuan. So saya nak tahu jugalah, semua antara lelaki dengan perempuan semua kena jaga kulit kan? Is it ada perbezaan ke kulit lelaki dan kulit perempuan sebenarnya?
Ada banyak perbezaan sebab perempuan kulit dia banyak dikawal oleh hormon juga. Dan lelaki sekali testosteron sahaja. So perempuan kita yang kita cycle of kitaran haid, macam-macam hormon dan sebagainya. So lelaki, of course lelaki somewhat selalunya lepas remaja, diorang takkan ada masalah jerawat. Kebanyakan mereka tak ada masalah jerawat selepas remaja, post after young adulthood, diorang tak ada masalah. Tapi ada yang berterusan sampai bila-bila ada masalah. Then of course diorang kena ada juga skin regimen macam perempuan. So it's up to them. Like to me nowadays, image is important. Everybody is on Instagram. Everybody is on, like it or not, image is everything. Sekarang mungkin rasa filter dah boleh tolong, tak payah lah, okay. Everybody will have flawless skin because of the filter kan.
Yes.
Kan bila jumpa tak nampak langsung dalam filter tu kan. So it's like filter tu sekarang ni nak cari jodoh susah sebab tak tahu betul ke tak orang tu rupa macam tu, okay. So jangan percaya sangat apa you nampak kat Instagram dan Facebook. So but to me I don't see why you kaitkan ada produk tu menyebabkan seorang lelaki tak macho. Mungkin dia it's not, ni tak ada kemacuan di situ lah. To me, if you are concerned about your skin and you want to have good skin, you just have to put an effort lah. Kita tepikanlah rasa macam tak macu ke apa, sebab itu tak ada berkaitan langsung bagi saya. Sebab itu memang kepentingan ataupun kesihatan dan you punya image, personality yang you nak tampil hadapan. So if you need to help and you need to maintain a good skin and you need to have 5 different types of products, go for it. But of course, men dia nak benda yang lebih simple, dia tak suka sampai 5 benda nak tutupi kat muka. Because they are, as compared to us, we are more like, kita sanggup lah go through all those things. But for men, dia nak benda yang cepat dan works. So I think for them, as long as they cleanse their face, they have good moisturizer and they have wear sunscreen, to me that's absolutely good enough already. For us, we can have 10 things kita tak kisah. Mungkin 10 tak cukup, nak tambah lagi. Kan? Perempuan lain. But I tak kaitkan kemajuan dengan produk yang digunakan lah.
Okay, alright. Okay, so Dr. I think semua question Q&A session pun saya rasa dah sampai ke penghujungnya. Saya rasa malam ni saya rasa yang tu saja untuk apa yang saya dah belajar banyak daripada Dr. pada malam ni. Banyak sangat. Okay, so before we end our talk, okay, sebenarnya ada pihak tim Selangor sebagai satu penghargaan, mereka telah menyediakan honorarium kepada doktor bernilai RM200. So hope that you can accept it.
Okay, thank you so much. Tak disangka rezeki malam ni.
Okay, so any last word from you?
Okay, last word from me is enjoy your youth. And as well as remember that health is the most important thing that you can have. Benda yang paling penting, aset yang paling penting dalam diri. So apa saja segala yang berkaitan kesihatan always titik beratkan, walaupun you rasa benda tu ringan, tapi mungkin dia boleh membawa kesan in the future. So apa saja you nak makan, apa saja you nak pakai atas muka, ataupun apa saja you nak consume as a product, selalu ambil tahu apa semua tu boleh, what can it cost to your body. Okay, whether you rasa benda tu bagus atau tak bagus, selalu fikirlah 2-3 kali ataupun a few more times kalau you rasa, especially benda tu you tak sure ataupun benda tu you memang tahu yang tak bagus, seperti you makan gula sampai 20 teaspoon a day just from a drink. So you think that it will not affect you now, but it could affect you later. So I'm not saying that tak boleh buat, tapi jangan amalkan sebagai amalan harian. Mungkin sesekali, seminggu sekali ke ataupun 2 minggu sekali ke, I'm okay. I feel that everybody needs to enjoy some nikmat in life kan, but not to do it as a lifestyle. So try and start jaga diri dan kesihatan daripada awal, sebab kita dah semakin lama semakin nampak yang muda-muda yang ada masalah perubatan. Dan kita tak nak generasi muda kita semua tak sihat. Sebab sekarang ni kita banyak sangat trend dan benda-benda yang kita tak boleh nak kawal dari segi peer pressure. We want to be in and we want to be seen doing the same thing every time. But be smarter in making the right choices, because all of you pun ada akses kepada informasi, internet in your fingertips, like boleh type je, like dia tahu semua benda, you know. Tak tahu apa kandungan benda ni, type je, oh you dah tahu apa dia, you know, this could have to do this and that. So learn to just be smart in the decisions you make now, because it would definitely give you the benefits later. Okay. So I hope all of you benefit something tonight. I myself always do, because when I have thoughts like this, I learn to connect and I learn things that, you know, what are the doubts out there, you know, things that I feel that, oh, I tak terfikir pula orang tak tahu pasal ni, that kind of thing. So it really helps me, opens up my eyes and my views about the public, and I always like to help in terms of clearing things up for everyone that has doubts. Yeah. So thank you so much for everyone that has made time to view. I know it's a precious 1 hour of your weekend, but I hope it did give you some sort of benefit.
Okay, thank you so much, Doctor. Okay, so untuk kemuncak talk kita pada malam ni, sebelum kita, saya akan umumkan pemenang-pemenang pertandingan poster sepanjang minggu COC 4.0 ini. So pemenang
before that, can I just comment about the posters? I really actually enjoyed watching what you wrote on the posters, and some of it are really beautiful. Memang cantik sangat-sangat, that I feel that macam, you guys really have talent, you have eyes for all these things. So very proud to see that you guys actually some time to participate in creating the posters, and thank you very much for those who actually responded to what I posted on my IG and actually participate in this, and you guys did a great job.
Okay, thank you, Doctor, for the comments. Okay, so for the poster competition, we have 2 categories. Okay, the first category which are students and also public categories. Okay, so first saya akan start dengan student category. Okay, for the third place, hadiahnya adalah RM70 cash and also Mary Kay facial cleanser. Okay. Tempat ketiga ni tahniah diucapkan kepada Najwa Syahirah binti Sofiuddin. Okay.
Congrats Najwa.
Saya rasa viewer boleh nampak kot poster beliau dekat live sekarang. Okay, so I'll just move on to
Next
second
slide,
place. Okay, untuk second place pula, okay, dia punya cash ni lagi up sikit. Up sikit. Ada pemenang akan menangi RM100 cash prize and also Mary K clay mask.
Okay, that's nice.
Okay. Okay. Saya ucapkan tahniah kepada Nur Sofia binti Amir Izham. Okay, so dekat
Congrats Sophia, make sure you use your clay mask.
use it well, okay.
Yeah, use it well.
Okay, so the first place, dia punya cash ni memang akan dapat 150 cash. Dan juga Mary Kay sunscreen. Bukan senang tau kita nak dapat free je macam ni kan. Okay, so the first place is Amilah Fadlina binti Muhammad Arif. Okay.
Yay, congrats Amilah.
Congratulations. Okay, use it sunscreen to
protect your skin.
Yes. Okay, so the public category. Okay, for the third place, hadiah sama je, RM70 cash prize and also Mary Kay facial cleanser. Okay, with third place goes to Nur Irdina binti Muhammad Hisham. Okay, saya suka sangat dia punya poster ni. Memang lawa. Bagi saya.
I'm sure it's pretty because like I've seen like a few yang macam cantiknya. So I tak ada talent, I memang tak ada talent nak buat benda macam ni semua.
Nice. Okay, so for the second place, RM100 cash prize juga, Mary Kay clay mask. Okay, the second place, congratulations to Nur Atika binti Muhammad Akmal Kong. Okay, so congrats. Okay, so untuk tempat yang pertama, 150 cash prize juga, Mary Kay sunscreen. Dia jatuh kepada Nur Amira binti Abu Bakar.
Okay, 150 kecil.
Semua boleh tengok poster-poster yang diorang dah buat, memang sangat kreatif bagi saya.
Very nice and creative.
Yes. Okay, so dengan pengumuman pemenang-pemenang tersebut, saya rasa takat itu saja talk kita pada malam ni. I think saya harap sangat penonton-penonton semua dapat pengetahuan yang baru daripada Dr. Liyana. Sebab bukan senang kita nak jemput Dr. Liyana kan. Kalau face to face lagi seronok, tapi virtual pun seronok juga. Okay.
Make do what we can at this hard time.
Okay, so saya rasa that's it. Okay, just stay safe everyone. Jaga SOP. Okay, kalau tak ada urusan jangan keluar duduk je dalam rumah.
Stay safe, stay healthy and keep yourself happy. Do whatever you need to do. Make sure yang penting you are free of stress. Okay, but as I mentioned, a little bit of stress is okay, but just handle the stress well and be with your loved ones always. Okay. Take care.
Thank you, Doctor. Thank you so much, Doctor. Good night, Doctor. Okay.